So what are the screening tests available for cancer?
So basically what the screening test means, screening means where we are doing some certain tests in a normal population, like where who are not detected to have cancer, doesn't have any symptoms or signs of cancer. Basically these population, when we do some test which are generally without any symptoms, and that will help in detecting the any presence of the cancer. Give an example, for example, breast cancer. For all the women beyond the age of 45 years, there is one test called mammography. It is ideally advised. If you do mammography every year, there is a possibility that if there is any chance of cancer developing or it is developed, we will detect it very early before it has grown to next stage. So this is basically generally what screening test means. That means we are detecting the cancer before it presents with the symptoms or signs. So we are trying to detect any chance of cancer before it started to grow. So generally what are the screening tests for the cancer means, first and foremost importance is the clinical examination by a physician or oncologist. That will give lot more of information than rather just only blood tests and any investigation particular. So clinical examination will be able to tell differences between normal lumps or any cancerous lumps are there. And for example, in oral cancer we can see the ulcers, there is any growth or any swelling which is not which is growing in size. So clinical examination is very important. For at least every annual clinical examination with an oncologist, it helps as a screening test. And coming to specific tests, like for most common cancer in the world is breast is the first among the women. Next comes the cervical cancer. In Indian population, cervical cancer is the first, and then comes the breast cancer. For cervical cancer, we have a screening test, pap smear screening we do. That is advised in older women, for women who are sexually active, and even postmenopausal women also. This is common in sexually active middle to old age group. So when we do pap smear, there is a one smear which is one test wherein from the vagina, when the cervix, we take a just sample and then we check it under the microscope. If there is any changes in the cervix, there is any swells are there, that will be picked up in the test and we will be able to detect the cancer very early. As far as like this, as I told you, for the breast cancer we have mammography for the women who are older than 45 years of age. There are other specific indications wherein we do some other tests like MRI of the breast. These are done in people or families wherein there is history of cancer in the family. For example, the mother had a cancer, or the sister has a cancer, or the grandmother had a cancer. They have high risk of developing the breast cancer or cervical cancer. In such cases, we do some things called MRI of the breast, which are not done routinely but for specific indications. Same way we have screening tests for prostate cancer in male, which is the most common cancer. For that we do a blood examination of prostatic specific antigens, blood value. If there is a certain limit, beyond that if the values is increasing, then we will do another test to confirm whether it is there or not. Other than that, we have a screening for lung cancer, which we do not in all population. We are doing for the patient or the population who are heavy smokers, those who have smoked for more than 10 years, those who have quit recently or is still continuing. Annual at least low dose CT scan we do. It's not the routine CT scan. This CT scan carries very low dose, and the risk of radiation injury from the CT scan is also low. That is one thing about the lung cancer where we can do with high risk population. Other than that, we have a colon cancer we do. There is a blood examination called serum CEA. If there is a cancer is present in the colon, this blood level will go up. So then again we may need to do colonoscopy to confirm. Other than that, every 5 years we can do a colonoscopic examination for colon cancers, and every yearly we do fecal occult blood testing. That is fecal matter, we check for any traces of blood in the fecal matter. And sigmoidoscopy is another test for colon cancer wherein we check the distal most part of the anal canal, that is our alimentary tract, last around 50 centimeter of the canal we check with the inside with the scope, sigmoidoscopy. These are the examples for a few most common cancers wherein screening tests are available, and if you follow the guidelines, if you go through the screening test, there is a high possibility of detecting the early cancers, and that will definitely give results, better results, and treatment chances and survival chances are very well improved.